You have a teenager who is autistic. Whereabouts in the spectrum is he?
He's autistic, very autistic, I guess. Someone did ask me the other day, was he severe? And no, Elliot's more in our world than others, so I wouldn't say very severe. For us, it means we live not a very social life. We spend a lot of time at home. He's very difficult to take out, and we've really had to adapt our whole life around living with a child with autism.
So Elliot wasn't actually born with autism. So tell us how that happened.
No, Elliot appeared to be born fine. He was going along the normal milestones through the Plunkett book as should be. And then he got sick and was taken into Starship with a gastrobug. 10 days exactly after that, we were at the GP who gave him his MMR vaccination. And within about a week, he had full-blown measles. He regressed, he lost the language he had, he lost eye contact. He was never our same little boy again. And over the next 6 months, we did the pathways of doctors and psychologists and paediatricians and ended up taking him to Australia to get a diagnosis of autism.
Now that whole MMR thing, that link is very controversial. And the guy who did the research, he's been discredited, but there's still a lot of people feel that there is some sort of link there.
There's a lot of argument, I guess, whether MMR is the cause of autism, and I won't go so far as to say that is that maybe Elliot's immune system wasn't okay when he had his vaccination, and for whatever reason he developed measles, which they've then turned to autism. And I guess if he didn't have the MMR injection, it may not have been the same, but I'll never know.
So this is it's actually tough for you as a family.
It's very tough as a family. You have to be 100% committed as a couple as well. Extremely tough, and yeah, it's tiring.
So what help is there available for you?
If you have a child who has autism, there is help. There's you go along to the needs assessment and you plead your case really, and you get allocated hours of home help, home support. If, however, you have a child with Asperger's, just recently, unless the child has an IQ under 70%, you don't get anything.
So that, I guess, would make life quite a lot more difficult.
Exactly, far more difficult. The other package we get as a family is we do get respite, but that, however, is very limiting as the options for respite are very few. I've become involved with a particular home where Elliot goes to now. We've formed a family governance group, and as a family we're working with the provider to better the house to make it more like a homely feeling for the children, and that's working well, but there are some others around that aren't so fabulous.
For you as parents, it strikes me that you're having to reinvent the wheel all the time.
Exactly, and I was just saying that to somebody actually yesterday, that why did we have to have the disability that's new? Because we seem to be treading new paths everywhere we go, from hair cutting to going to the dentist to attempting to take him shopping, even medication. Children with severe behaviours that have now suddenly appeared, and psychiatrists are saying, but our medication's only for adults, so they're having to give adult antipsychotic medication to children, and there's some really severe side effects coming out of that.
Let's talk a bit about treatment, because that also has got something of a split on how people with autism should be treated. There are some who say antipsychotic drugs, chemicals are the answer. Others are saying, well, actually there's a biomedical way of dealing with it, and it's a case of finding foods that you're allergic to and stuff like that. Are there answers?
I don't think there's clear answers. I think you'll find amongst the autism community different sects doing different things, and the biomedical approach will work for some children, won't work for them all, and it's also very costly. So, and the same with the ABA, the Applied Behaviour Analysis interventions. Again, most of those are private, so families that can afford to pay for them, that's fine. In terms of the drugs, it's a bit of a guessing game in terms of, let's try this drug and see what happens, because our children seem to be so sensitive. They react differently to what the book says. So families are trying everything they can, because obviously you want to make a better quality of life for your child and for your family. So I just feel very sorry for the families who haven't got that extra get up and go, maybe, to inquire as to what there is out there, because I find you're forever researching, networking, talking to others to see what may be around the corner coming up new for autism.
It seems pretty much that your life as a family ends up just revolving around autism.
Our life is completely involved around autism. I mean, you know, we go on the internet, what are we searching autism? What do we look for on, if there's something on TV that's autism we're watching? Whether it be autism itself or whether it be treatments, cures, drugs, therapies, interventions. Our friends and our parents of children with autism, and our social activities work around what can Elliot do and what can't he do.
So what about the future for Elliot? What will happen to him as in a few years he's going to be in his 20s?
We're just, we're going through that horrible, scary time at the moment of what will happen to Elliot. I don't have family that can take Elliot, so, and Elliot's an only child. So I'm looking ahead at what there is available in New Zealand in the residential area, and quite frankly, there isn't a big option or a good option. So the Autism New Zealand board have decided to undertake a project to look at what there is in the way of both respite and residential for these kids, young adults, and see if maybe we can set up a new as a provider, have a look around and see what we can provide, because at the moment there's nowhere I would send Elliot.
In an ideal world, what would you like to see happen?
What I'd like to see is more professionals specialising with autism. There's a tidal wave of children between 12 and 16, boys going through puberty, aggressive, needing some form of medication, and I find, having just walked that pathway, that the doctors really are unsure of some of that medication. So we need some experts who've been there before or researched in that field. We also need better resources for families, for respite, for home support. We need to have more teacher aides in schools. There needs to be more resources in schools. There's several children going to school without teacher aides, only managing to last a day, half a day at school, being sent home. It's not good enough. You know, so there needs, I know money is a problem, but there certainly needs to be more resources put into the field of autism.